had one this morning where we have attended, and it's been left in the hands of ambulance.
So what was that call?
So this started out as an incident where an officer attended for something completely unrelated, and then whilst there, the female said that she was having suicidal thoughts. So the officer called the crisis team, sort of as per right person, discussed with them, and they suggested sending an ambulance, and that was what was done. A friend then waited with her until ambulance came and police resumed.
This is Beth Revel and John Mole, response officers for the Humberside Police, and they're talking about right care, right person, a new way of dealing with mental health calls.
The hard bit comes in when you feel like you've let somebody down in a way that they've rung you for help and you're saying, no, this probably isn't for us, please ring somebody else.
Essentially, this is the police saying no, that there are other agencies who can or who should be dealing with this. It took Humberside Police more than 2.5 years to implement this model, and that is an important point. They were working slowly and carefully with health and social services, ambulance services, mental health crisis teams, the local authority. All based on a simple fact. Officers sitting in a hospital emergency department looking after someone in crisis and not out there fighting or preventing crimes.
In terms of policing, we know what we're good at. We're there to prevent crime, we're there to detect crime, and if there's an immediate risk to life, we keep people safe, that's what we do. But it's not possible that we can do everything across an entire public service.
So this is Humberside Police Force Control Room.
And this is where the calls come in and the decisions are made about how to deal with them. If a call comes in here right now and they say, I'm a little bit worried about my neighbour, haven't seen them, curtains are drawn, they've got mental health problems, can you come and check? What would you do now?
So it depends on the actual circumstances. Hang it off the side of a bridge, on the top of a multi-agency, the multi-storey car park, if they are weaving in and out of traffic. That's going to be the police day in, day out, because we are the only agency that can do that. But if we're talking about somebody who maybe just has some emotional dysregulation, struggling with the day-to-day challenges of life, or maybe is not at that crisis point but needs some intervention, then often we're not the right agency to do that.
Humberside Police, how can I help? We will send it through and see if we can get someone there to just check on her. All right.
The result is 540 fewer police deployments a month in Humberside, equating to 1,441 officer hours a month. And now it's to be rolled out nationally, with police forces across England working on their own versions of right care, right person. In the time we've been here, there have been 4 or 5 calls that would fall into the right care, right person category. Now, let me give you an example of one. It's an elderly woman, possibly with dementia, definitely not being well looked after. The community nurse couldn't get into the house, so she called the police. Now, the police have said, in this case, call social services first. So that is a call they won't be dealing with right now. But this is the issue for the other police forces who are going to have to implement this at some point. They have to work out when they're needed and when they can bring in outside partners like the NHS, like social services, like the community nurse. Everybody we spoke to said it was important to collaborate with all the services and not to rush implementation. Yet the Metropolitan Police announced a 3-month timetable, only delaying it after criticism that that was far too quick. It will, though, start at the end of next month. The Met said the short extension brings significant benefits of more time to train staff, increasing operational confidence, and allows more time for partners to plan for the change. But there are concerns as it's taken up nationally.
We are hearing anecdotal reports from our members that already forces either that aren't implementing or are only part-way through implementing, officers on the street and call handlers are saying the words, "We don't do mental health anymore." And that kind of blanket refusal to attend something when a mental health situation is ongoing is something that is of real risk, because there are several situations where police absolutely have a role and do need to still attend.
And given that this all started with the data, little is available in the way of what impact this has had on patients. Zoe Blood has had several crises, including time spent with the police in a hospital emergency department.
It was a good few hours, like I said, maybe 3, 4, but because I wasn't very well, I can't remember for sure, but it was a long time, or it felt like a long time.
And do you understand the idea that this is police time that might have been used better elsewhere?
Yeah, I don't think they were the right people to give me a face-to-face intervention. I don't think that it's nothing against them, but they don't have the training. They're not mental health professionals or clinicians.
And back in Humberside, I asked about the impact just saying no has had on other services.
What needs to be understood nationally from Humberside is that this isn't something that's happened overnight, that it's not been a 3-month, 6-month. It's been a journey of years, and it's been about phases. And I think what started with the police being aware of the challenges that were faced by mental health services, where we've got to is a shared understanding around when are the police needed in this situation, and when are mental health services needed, and coming together to have conversations about that.
None of this comes with the promise of more money. In Humberside, the NHS told us they had reprioritised their funding to ensure mental health services could cope, and each region will have to do their own financial juggling.
I think the point of it really is just the person at the end of it all.
But they have made it work here, and there are more police back on the beat.
Well, I'm joined now by Dr. Sarah Hughes, who's Chief Executive of the mental health charity Mind. Well, let's start where Victoria left off. This is working for Humberside Police. Is it working for mental health patients, do you think?
Well, it was great to see our friends in Humberside talk about right care, right person. I think people in the community would say it could work if we had more resources in the community. So I think for the police, they've seen in Humberside huge progress in terms of organisations responding to this. I'm not too sure what the public might say, but ultimately it's about what other resources are available, and that's the bit that's not there.
And police will attend if there's a threat to life, that's clear. But I suppose your concern is if people are in acute distress or they're at risk of self-harming, those people might then fall through the gaps if there's not an adequately resourced mental health service in place.
Absolutely. So we were assured by our colleagues in Humberside that they undertake a really, inclusive and thoughtful assessment when they get those triage calls through. So we shouldn't get to a situation where somebody who is suicidal or who is at risk wouldn't get help. So we absolutely think that if right care, right person is implemented correctly, that people shouldn't fall through the gaps. But unfortunately, what we're seeing is that the system around individuals isn't quite in place.
So you're pretty confident that it's working in Humberside. Elsewhere, there's been a bit of controversy about the Met Police, for example, as Victoria was mentioning in her report, that they tried to sort of rush this through in 3 months. I mean, they might say that they needed to kind of put a deadline to incentivise the NHS to come to the table and do a deal.
Well, that would work if the services could be developed overnight. And I think absolutely we really concur that the police are not the right people all of the time. They are some of the time. But the issue that we're facing is that people with mental health crisis need alternatives to, being sectioned on the street or taken to a police station. They need alternatives like crisis cafes or sanctuaries. And those are the things that we haven't seen the investment in. And that's the problem. We're not disagreeing with the principles or the outcome for sure. And we know that for individuals that having the police turn up, it can be terrifying. So absolutely not. But we have to do that in a considered way, thoughtful, with the right policy, the right services in place. We need to have Mental Health Act reform. We need to be able to see that, third sector organisations are having the investment that they need, that emergency services have got the right training. We're not there yet.
I mean, it so often comes back to resources, and, I suppose in some ways you try and find solutions that are not resource intensive because everybody knows how short the cash is at the moment. But at the same time, when you hear that Humberside reprioritised funding, the NHS did, is that a solution in other areas too? Is it possible?
Of course, absolutely possible. And I think that that's what we're seeing when there is a creative relationship between emergency services, between local authorities, between third sector organisations. If they come together, they can creatively look at what alternatives there are. But if they're not talking together, if they're not those relationships, or if they're not prepared to take risks and share budgets, we're not going to see the progress we need to see.
So it's all about collaboration. Dr. Sarah Hughes, thanks very much for joining us.